Okay, so I guess to start off, Dr. Moon, can you kind of describe the Target-NASH study, what the goals are, and what you think will ultimately be accomplished by this?
Yeah, so Target-NASH is an ongoing longitudinal cohort of adult and pediatric patients with non-alcoholic fatty liver disease. So that includes patients with simple steatosis, patients with non-alcoholic steatohepatitis, meaning they have liver inflammation, and patients with cirrhosis from NAFLD. So these patients are identified and referred by gastroenterology, hepatology, and endocrinology clinics all over North America. And so these patients are enrolled after they provide consent to be included in the study. Clinical data is extracted from their medical charts, and they're followed prospectively for up to 5 years after enrollment. And the goal is to really better understand non-alcoholic fatty liver disease and better understand outcomes in these patients.
Okay, and now this specific report involving opioid use among this patient population, what is your main takeaway from this?
Yeah, so essentially what we did was we identified everybody who had been enrolled in Target-NASH. We looked back to see if they had been prescribed opioids within the 1 year prior to enrollment. And we were trying to see how common opioid use was and what were the risk factors for opioid use. And what we found was that opioid use was relatively common and was reported in about 1 out of 5 NAFLD patients. It was more common among patients with a higher BMI, patients with more advanced liver disease, such as those with cirrhosis, those with psychiatric comorbidities like anxiety and depression, and those with painful comorbidities like arthritis.
Okay. Now, what can we take from identifying these patients in an attempt to kind of reduce the number of patients on opioids?
Yeah, so I think first and foremost, we need to maximize and optimize safe pharmacologic analgesics, such as low-dose acetaminophen for patients with cirrhosis. We also need to employ a comprehensive pain management strategy for these patients, especially because they're the ones who are most at risk of side effects from opioids. Second, we need to identify and provide proper treatment for psychiatric comorbidities such as anxiety and depression, which were associated with an increased risk of opioid use. And lastly, I think we need to intervene early in patients with painful comorbidities in hopes of addressing their pain with safe strategies and allowing patients to stay active, which is really essential for patients with non-alcoholic fatty liver disease, given that physical activity is a cornerstone of treatment.